Honorable members, prayers. Almighty God, we humbly beseech Thee to look with favor upon this Parliament of the Republic of Ghana. Grant that it may perform its high duty as in Thy sight. Give divine guidance to the President of the Republic. Endow members of Parliament and ministers of state with discernment and vision, integrity and courage, that through the labors of government, this land and people may be well and truly served, and that good purposes for the common human life be realized in our midst. Amen. O God, grant us a vision of our country, fair as it might be, a country of righteousness, where none shall wrong his neighbor, a country of plenty, where evil and poverty shall be done away with, a country of brotherhood, where all success shall be founded on service, and honor shall be given to the deserving, a country of peace, where government shall rest on the will of the people and the love for the common good. Bless the efforts of those who struggle to make this vision a living reality. Inspire and strengthen our people, that they may give time, thought, and sacrifice to speed the day of the coming beauty of Ghana and Africa. Amen. Honorable members, correction of votes and proceedings. I'm told some official reports are ready. Official reports on the 7th has been distributed, and the 8th will be distributed today. Please kindly take time to go through them because of what happened on the 7th. Make sure that they are properly captured as the proceedings of that day. Again, 1. Page 2. Yes, Honorable Second Deputy Speaker.
Right, Honorable Speaker, page 2, number 57. Right, Honorable Speaker, the name Amuako was corrected about 2 days ago, and still it's still written wrongly. The name is A-M-O-A-K-O, not K-U. So the table should. Thank you, Mr. Speaker.
Table office, let this be the last time the Honorable Second Deputy Speaker will be drawing your attention to the correct spelling of his name. Page 3. Page 4. Page 5. Page 6. Page 7. Page 8. 9. Page 10. Yes, honorable member.
Hello. Hello. Yeah. Well, right, honorable Speaker, on page number 10, item number 2IX, Dr. Abdul Rashid. It should be Hassan Pelpo. Hassan has been captured wrongly. And my good-in-law is not here, so I owe him that favor. So I'll remain in good standing in the family. So, right, honorable Speaker, Hassan should be corrected. Oh, it should be enough. Hassan. That should be the correct rendition. I thank you, Mr. Speaker.
Table office, please take note. Page 11. Yes, honorable member.
Right, honorable Speaker, page 11, the first item X. The honorable Joycelyn Tete's name has not been captured accurately. It should be Joycelyn, J-O-Y. The Y has been omitted. So if it can be corrected accordingly. Thank you, Mr. Speaker.
Table office, kindly take note. Honorable members, the votes and proceedings of the 8th sitting of the first meeting of the first session held on Thursday, the 28th January 2021, as corrected, are adopted as the true record of proceedings. Honorable members, we take item 4, business statement for the 5th week. Chairman, Business Committee.
Right, Honorable Speaker. The Business Committee met yesterday, Thursday, the 28th of January 2021, and arranged business of the House for the 5th week ending Friday, the 5th of February 2021. Speaker, the committee accordingly submits its report as follows. Speaker, you may read any available communication to the House. Speaker, unfortunately, what I notice is that the provision as contained in the order paper usually refers to communication by the Speaker alone. You don't relate to communication from the President. So maybe the table officers may be advised to do what is provided for in the standing orders. The Speaker, papers may be late during the week, and reports from committees may also be presented to the House. Motions may be debated and their consequential resolutions, if any, taken during the week. The Speaker, as honorable members may already be aware, seating arrangements in the House have been reorganized in line with physical distancing protocols. Furthermore, given the upsurge in cases of COVID-19 infections and associated deaths, the Business Committee recommends that the Clerk to Parliament takes steps to ensure that only essential staff of the Parliamentary Service report to and undertake official duties. Mr. Speaker, honourable members are also entreated to curtail visits by constituents and other acquaintances to their offices, as we resorted to in the lead up to the elections and when the disease was about peaking last year. The Clerk of Parliament is further requested to liaise with the Dean of the Parliamentary Press Corps with a view to reducing the number of media personnel who attend the House to cover proceedings. Speaker, all other visitors who have no critical business to transact in Parliament will not be permitted in the presence of Parliament. Right Honourable Speaker, an induction seminar has been organized, programmed for members of Parliament. It is expected to take place from Friday to Monday, the 8th of February 2021. Members are programmed to check in at the Aqua Safari Resort at Darfur on Friday, the 5th of February 2021. Speaker, it would then mean that next week Friday we may have to take an early adjournment. The seminar would end in the afternoon of Monday, February 2021. Further details on the induction seminar will be communicated to honourable members in due course. Speaker, in accordance with Standing Order 160 sub 2 and subject to Standing Order 53, the committee submits to this honourable House the order in which the business of the House shall be taken during the week under consideration. Speaker, the draft statement is set out in the papers before us, and it is not my intention to go through item by item per each day. And I would invite the Hansard Department to deem the entirety of the report as having been read and capture same in the Hansard. The Speaker also submits.
Yes, any comments, remarks? Yes, Honourable Member, Honourable Clement Apak.
Thank you, Right Honourable Speaker. And I want to thank the leader of the majority group for ably presenting the business statement. Honourable Speaker, I rise to ask for clarification with regards to item number 4, induction seminar. Honourable Speaker, given the times in which we are, and given that if all members were to attend, we would be in the number of 275. Would it not be helpful for us to consider breaking ourselves into 2 groups, or at least 2 tranches, so that we can properly observe the protocols? I don't believe that the venue for which we have been assigned to undertake this seminar would have the capacity to host all of us in a manner that will not expose us to the risks for which we are gathered here today. Thank you, Right Honourable Speaker.
Yes.
Most grateful, Right Honourable Speaker. Right Honourable Speaker, I rise to seek your guidance in relation to the item number 3, observance of COVID-19 protocols and the new seating arrangements Mr. Speaker, the new sitting arrangements has created a practical challenge, and that came to the fore yesterday, particularly in relation to Article 1041 of the 1992 Constitution, which reads, Mr. Speaker, with your kind permission, except as otherwise provided in this Constitution, matters in Parliament shall be determined by the votes of the majority of members present and voting, with at least half of all the members of Parliament present. This is a constitutional provision, which also, Mr. Speaker, finds expression in Standing Order 1091 of our standing orders. I think it was basically lifted in extenso, Mr. Speaker. So we have this challenge, and yesterday it appears that you relaxed the rules and allowed for a vote to be taken. But what happens if we are confronted with another situation where decision has to be taken, half of us must be present, which speakers have ruled in time past that half of 275 is 138. What happened yesterday, if it continues, it will mean that a considerable number of our colleagues will be left out of voting, and we may not even be meeting this constitutional provision of having at least half present and voting. So I think that moving forward, Mr. Speaker, you need to offer some guidance so that if probably decisions have to be put, some time frame will be allowed for members to be called if they are in their offices or they are probably close by maybe an hour or 2 hours, or a decision might be deferred to another day, so honorable members can then come and take part in the vote. Or are we going to employ technology where people can log in and we are sure that we have at least half of members who have logged in, and so the decision can be made? If not, we may run into constitutional crisis. Somebody can even go to court and challenge the decisions that will be taken under this COVID environment. So, Mr. Speaker, I think this is a very important matter that will require your guidance and your ruling moving forward. I thank you, Mr. Speaker.
Honorable Dr. Sebastian Sandal.
Thank you, Right Honorable Speaker. I rise to make a comment on the point number 3, that's observance of COVID-19 protocols. Mr. Speaker, as much as I commend the Business Committee for the recommendation to limit visitors and ensure that we comply with the social distancing protocol, I realize that it's not enough because I've made some observations, especially in our washrooms, both at the offices and the chamber. Sometimes you realize that there's no soap, there's no tissue, water is not flowing well. And for me, that is very, very critical, because just limiting visitors is one aspect, but also ensuring that the facilities to ensure that we wash our hands very well must also be obeyed. And I want that to be part of measures that should be taken in this House. And lastly, Mr. Speaker, to also say that I also noticed that yesterday, during the motion, I realized that the rule that was made that some numbers should remain in the offices while some are here to ensure social distancing was disobeyed, especially by the other side. I don't know what happened. They just rushed in. There was no social distancing. And we took it for granted because the virus will not come every day because you are crying. One day, just disobeying the protocol will be that day you will spread the virus. And I think that we should obey fully with all the protocols that we have, decided on. Thank you very much, Mr. Speaker.
Yes.
Mr. Speaker, let me thank you for the opportunity and to commend the chair of the Business Committee, except to say that I disagree with him when he referred to formal communications by the Speaker. What is provided in the standing orders or the 53-1 and what is captured in his own business statement is appropriate by our standing orders. There is nothing like formal communication from the President. What is presumed there is that if the Speaker has any communication from the office of the President, he will convey it as part of his formal communication. So, Mr. Speaker, I refer the leader to Order 53-1 and I do not see anything. Mr. Speaker, the chairman of the Appointments Committee, First Deputy Speaker, is not here. So on his behalf and on our collective behalf, the Appointments Committee have met and we are requesting for public memoranda in respect of all the President's appointees to the various ministerial positions. We are expected to commence vetting or scrutiny of the President ministers on the 10th of February. Priority will be given. I have not had time to brief the majority leader. Priority will be given to some ministers, particularly health, because of the COVID situation in the country. And probably he would be the first minister to be considered by our committee, followed by those other ministers of national security and finance. Now, Speaker, our clerk is working to get the publications to all the media houses. And then, Mr. Speaker, on my own, the COVID situation in the country is worrying and gives some room for concern. We reported cases of about 62,751, active cases 3,813, with some 377 deaths. Even though we do not have the Minister for Health, the President had appointed somebody responsible for matters relating to COVID. I didn't have the opportunity to be at Business Committee. We may have to ask for an urgent briefing from them on what we are doing if we have to isolate, if we have to take the critical decisions that prevents an upset. And I thought that I should bring this matter to the fore. And Mr. Speaker, again, as the Honorable Ablakwa and Doctor observed, yes, social distancing. Yesterday, we didn't see our colleagues opposite respect the protocols. So we have a difficulty choosing between constitutional obligations and working to avoid upsurge of COVID. Mr. Speaker, you know that this Parliament is 137, nothing more. Our colleague opposition should stop living in the past as if they still have comfort of numbers. At every time we will be here, we know the numbers. Technology, I agree with him. He quoted Article 104, Standing Order 109. I know that before the board, there is a matter relating to deployment of Wi-Fi and broadband technology. When the board does take a decision with it, I'm sure members can even vote from their offices or from the comfort of their home. So we need to take active decisions on it. But when one side decides that we will limit our numbers because of COVID, and we see others populate their numbers because of an essential vote, then you come here now preaching that we should respect protocols. What protocols? When there is a vote, there will be a vote. We all bear the consequences. When there is a vote, there will be a vote. We bear the consequences. Thank you, Mr. Speaker.
Chairman of the Business Committee may may respond.
Speaker, the Honorable Dr. Clement Park has raised a very critical matter. It has to do with holding the orientation at Aqua Safari. I think we're in the process of looking at other alternatives, and a suggestion came through that we could be meeting at Hull, at this Serena, Volta Serene, and we're told that it has the capacity for about 800 people, and indeed if we physically distanced, it could accommodate between 400 and 500. We are told there are other close-by facilities where all of us could be. Well, there was another meeting that I couldn't be present at, and the indication that I had was that it's been agreed, because of some earlier commitments to Aqua Safari, that we hold the meeting at Aqua Safari. And then, as Dr. Park is saying, if we have to hold it there, then we have to divide ourselves into 2 batches and have it done. And I thought that maybe having it at Hull, at Serene Hotel, and all of us being there to listen would be a better option. However, I think it's something that we can take on further with Right Honourable Speaker. If it has to be Aqua Safari, then it has to be in 2 batches. If it has to be in Water Serene, in Hull, then perhaps all of us could be at the same place at the same time. But as I said, it's something that we may have to look at. With the Speaker presiding. The Speaker, the Honourable Okujeto raised an issue in respect of the import of Article 104. Fortunately for us, Article 104 is not one of the entrenched provisions. And if we have to, in the midst of the pandemic, have to have a second look at it, I guess, as a House, we can come to some determination on that. The issue raised by the other colleague, I think a medical officer himself, in respect of the irregular water flow in the washrooms and the absence of tissue, I guess is something that the House Committee or leadership for now, because the House Committee has not been constituted yet, may have to look at maybe involving the whips. We have to have a critical look at, because certainly we'll be imperiling our own lives if that is the case, and I have no cause to disbelieve what my colleague has said. He went on to indicate, and he's been joined in that statement by the minority leader, that yesterday, in the course of the debate, the other side, that is the majority side, some members rushed in the lead up to the taking of the votes. I was in the lead up to the taking of the decision, I should say. The Speaker, I cannot bear testimony to that. What I do know is, on the right-hand side of the minority leader, which was not populated, in the lead up to a decision, people flocked to populate your right-hand side. We are not talking about that. The minority leader is not talking about that. That is really a difficulty. If you come into equity, you must come with clean hands. Leader, with respect. Please, I think that we are conjoined to live together and collaborate with sincerity and honesty. Sincerity and honesty, not telling lies, because it doesn't help in the building of bridges. I can bear testimony and raise my head up to God, yes, and say that to the best of my ability I'm sincere, and I live with sincerity. In terms of building bridges and consulting, I'm not too sure that there's any majority leader in this house who has reached out to the minority than I have done. And I see the Honorable Cletus nodding at me. I know he knows what I mean. Mr. Speaker, so I believe that we have to build bridges and collaborate further. The issue raised by the minority leader in respect of the COVID briefing, we don't have a minister of state in place as of yet. If we agree that the caretaker person should lead the effort and bring in the technical people to brief us, and I think it will be necessary in the committee of the whole, I think that will be necessary for us, given the fact that in this house, in Parliament itself, the cases are rising. I will need to be careful and cautious so that the cases don't escalate. I think it's important that we are all cautious and take steps to protect ourselves. And those steps will be predicated on the briefings that we may further have. I think ultimately we want to make the place safer for all of us, so that we are sure in our minds that what we do, which we believe would inure to the interest and benefit of the nation, is not done at the peril of our own lives. Mr. Speaker, thank you very much.
Thank you so much. If I may clarify some issues. The order of business in the House, Order 53, is very clear as to communications from the presidency. D53(1)D says messages from the president. Anytime we receive a message from the president, we put it on the order paper. The E deals with formal communications by the speaker. And definitely, I am always ready to make formal communications. And so I directed that they should maintain it on the order paper. That is what we have now as a guide to the order of business in the House. With regard to the import of what happened yesterday in respect of Article 104, I want to assure members that we complied with Article 104. Whether members flocked in or flooded is not the issue. The issue is the numbers. Did we actually get at least half of all the members of Parliament present? And I said, yes, we had more than half of all the members present at the time we took the decision. So there is no issue there. And the table office is very observant. And usually we try to take a count before we put the question. So there's no need, whether it's entrenched or non-entrenched clause, for us to take a second look at it. With regard to the COVID situation, my directive that all members subject themselves to the test has not yet been complied with by over 60 members of Parliament. It is true, as the Majority Leader has just stated, that we are not all safe. Even in the House, some members are afflicted by COVID-19. You may not know who the person is because of the protocols, issues of confidentiality. We are not disclosed those who are now COVID-19 positive. But we have some of us in that category. And so members should take the protocol seriously. In fact, when I was entering, I myself had to signal some members to respect the physical distancing. The physical distancing protocol. And I saw them immediately move apart. So members should take it serious. The numbers started slowly and it is rising. I don't want to be compelled next week to read out the names of those who haven't complied with the directive. And so this is the last call I want to make on members, because the team from the Noguchi Institute will be available on Monday and Tuesday. Today, Monday and Tuesday, they are attending basically to the staff, both parliamentary and support staff. So I expect that we should take advantage of the 3 days and get tested, not just for your good, but for the good of all the members of your family, your friends, and your colleagues here in the House. So please, that should be the last call I will make. If I see that members are not complying, I will be compelled to read out the names of those who have not yet undergone the process of testing. I thank honorable members for drawing attention to the state of affairs at the washrooms and offices, including the chamber block, as to the lack of water or other accessories to at least enable members to comply with the protocols. I think the parliamentary service will take serious view of it and make them available. The orientation and induction will take place in 2 phases because of the COVID. Finally, I directed that the first, which is starting on the 5th and ending on the 8th after lunch, will be for the freshers together with leadership. The senior members will have theirs next weekend. I had reports from 3 sites or 3 areas where we could have held the induction and orientation. That included Ho, that included Akosumbo and Ada. The reports were discussed extensively, and we finally arrived at the decision that we could use the facilities at Ada. And so I'm aware of what the majority leader was alluding to. But there are other issues apart from just availability of space. And so all those things were taken into consideration. So we finally decided that the 5th is arrival and Monday eve after lunch is departure. And I said that is for the first timers, who are 123 in number, plus leadership 12, making 135. The second will be for, as I said, continuing members, whether it's the 2nd, the 3rd, the 4th, the 5th, the 6th, or the 7th. I think the 7th are only 2. Including the majority leader. And now you are 3. I shall return. Yes, the 7th. The return is not up to 7. It is 6. This is the second time of returning. So you have to commend him highly for in, out, in, out, in. It's a very good experience to share with members. Yes, honorable members, we move to, I think, the business statement as presented and commented on by members is duly adopted as the business for the 5th week ending Friday, 5th February 2021. Item 5. I have admitted a number of statements, but in discussion with the members concerned, we decided to zone on the statements on COVID-19 for today, and then next week we'll take up the other statements. So I have admitted 3 statements all on COVID-19. And I want to grant the opportunity for the members to make the statements. We have the first that came honorable members, my attention has been drawn to some urgent matters, and so I will, under Order 53(2), grant leave that the order of business as set out in the order paper be altered for today. So grant opportunity to the leaders who have some urgent matter to transact to take us through item number 7, which is motion. Item number 7, motion, leadership of the House. Yes, Majority Leader.
Mr. Speaker, I beg to move that this Honorable House approves the following Honorable members to compose the membership of a committee to advise Right Honorable Speaker on the appointment of 4 other members of the Parliamentary Service Board. And the members involved are my humble self, Osei Chairman Sabonsu, the Honorable Haruna Idrisu, the Honorable Alexander Kwamina Afenyo Maraking, and the Honorable James Kluche Aveji. Speaker, I so move.
Any seconder? Yes, Honorable Deputy Minority Leader.
The motion moved by the leader of the majority group, who is also a member of the committee. And for that matter, I'm also a member of the committee, and I second the motion.
Motion moved and seconded is for the consideration of the House. Yes, Honorable Mohammed Muntaka.
Thank you, Mr. Speaker. Mr. Speaker, this is a motion that usually will not require much debate, except to say I thought that the leaders will have allowed others to do the moving and seconding, since they themselves were going to be on the committee. Mr. Speaker, it's with our practice that usually you have the Speaker advise, and in advising also you take into cognizance that the 2 leaders that leads the both sides of the House, who are part of the committee to advise Mr. Speaker on the composition of the Parliamentary Service Board, are technically going to be, they will be recommending themselves to the Parliamentary Service Board in line with our practice. And I thought that would have been one of the reasons why we should have chosen others to do that. But that notwithstanding, since it's intended with our practice that the 2 leaders of the House will usually or has always been part of the 4 that will be nominated and advise the Speaker to get them to be part of the Parliamentary Service Board. We remember that as they are going again, because Honorable Osei Chairman Sabonsu have been privileged to be part of this Parliamentary Service Board. I think this is the 4th consecutive times. And Mr. Speaker, your good self have been on it a number of times. And one of the major challenges that this House has always had is that matters that need to be discussed at the House Committee are hijacked by the Parliamentary Service Board. I hope with the experience that both you yourself and the like of Honorable Osei Chairman Sabonsu have, this time when you advise Mr. Speaker and you get yourself on the Parliamentary Service Board, you fashion out a method and a procedure to ensure that the House Committee works very efficiently to take good care of the issues that affect members, so that when it comes before you, you deal with them expeditiously. And it is our also hope that as you advise Mr. Speaker, you should also remember our colleagues who are former MPs. Because even though I know it's been the practice, once in a while you get one of them joining. Because this institution is now old. After almost 28 years, we can no longer complain that we don't have experienced former MPs. And it is my hope that as you go to advise the Speaker on who should be part of the Parliamentary Service Board, you have this at the back of your mind, so that we'll begin to use our own who have passed through this House, appreciate the challenges that are in this House, the difficulties, and the opportunities that could avail the sitting MP, so that the Parliamentary Service Board will not only work to project this House good in the eyes of the public, will protect our staff and will protect the interests of members of Parliament. Mr. Speaker, with this comment, I thank you for the opportunity to contribute to the motion. Thank you.
Honourable members, this is a straightforward matter. We've noted the comments made by the Honourable Member for Asawase. I'll put the question. Those in favor of the motion, say aye. Those against, say no. The ayes have it. The motion is adopted. Honourable members, we now return to item 5, statements. I have 3 statements from members, all on COVID-19. I will take the statements as they came to me. And therefore, the first statement that was admitted in this respect stands in the name of Honorable Ladi Ayi Ayamba, the Member of Parliament for Pusiga. It's on the effects of COVID-19 on women and children in Ghana. Honorable Member may make the statement now.
Thank you, Mr. Speaker. Thank you, Mr. Speaker, for the opportunity to make this statement. Mr. Speaker, COVID-19, or the coronavirus disease, is defined as illness caused by a novel coronavirus, now called severe acute respiratory syndrome, coronavirus 2. Formerly called COVID-19. Mr. Speaker, according to the World Health Organization, most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. This is not in the case of older people and those with underlying medical problems like diabetes, chronic respiratory disease, cardiovascular disease, and cancer that are more likely to develop serious illness when they contract the virus. Mr. Speaker, it is also worth knowing that the best way to prevent and slow down the transmission of COVID-19 is to be well informed about the disease, its causes, and how it spreads. Mr. Speaker, one can protect him or herself from COVID-19 by frequently washing of hands, using an alcohol-based sanitizer, frequently not touching the face. Mr. Speaker, pandemics such as COVID-19, compounded with other prevailing gender inequalities and vulnerabilities, increases risk of abuse of women and children in our society. Women and children are always at the receiving end because of the heightened tensions in the household. Mr. Speaker, due to the partial lockdown in 2020, in March 2020, as a result of COVID-19, economic activities were disrupted, especially the self-employed were forced to temporarily shut down their businesses. The disruption in economic activities placed both financial and psychological burden on women who are mostly breadwinners in the family. The pressure of not earning an income during this period resulted in violence being meted on women and children who are mostly vulnerable. Mr. Speaker, according to UNICEF, in their report released in November 2020, titled Primary and Secondary Impacts of COVID-19 on Children and Women in Ghana, detailed how COVID-19 impacted on the lives of women and children in the country. Mr. Speaker, below are some of the findings contained in the report. More than half of the children covered by the survey live in households whose principal stopped working for COVID-19 reasons. 79% of the children face a reduction in total household income compared to March 16, 2020. 24.1% of the children aged 6 months to 14 years had fewer meals than usual in the 4 weeks before the survey. 44.2% of the households with children aged between 6 to 14 years have stopped receiving meals from school feeding programs since school closures. There is limited use of healthcare services. More than 35% of the households with children sick in the 7 days before the survey sought medical treatments from pharmacies and chemical drugstores. Mr. Speaker, for fears of COVID-19, infections are the main reason for not making antenatal care visits to health facilities, nor vaccinating children as per schedule, followed by income and mobility restrictions. A high percentage of children have presented emotional changes since the pandemic, with up to 30.4% of the households reporting having children aged between 6 to 17 years who felt sad more often. Nearly half, about 45.6% of the children born since March 16, 2020 have no birth certificate, no registration with civil authorities. Mr. Speaker, child labor has increased among children between 5 to 17 years old, especially for household chores, 34.8%. More than 1/5 of the children live in households in which physical punishment has become common, 20.9%, with no gender difference. Mr. Speaker, a significant number of children normally attending primary and junior high school, that's about 34.8%, or senior high school, about 28.1%, have not engaged in any education or learning activity since school closures. Almost every household is aware of preventive hygiene measures to reduce the risk of contracting COVID-19. However, 21.7% of the children live in households without regular access to water supply and 17.7% without regular collection of solid waste. Mr. Speaker, it can be seen that most of all the statistics contained in the report above did not go in favor of women and children since the inception of this pandemic. Mr. Speaker, in recent times, violence against women and children has increased, and if care is not taken, may generate into another pandemic that the country might not be able to handle. Mr. Speaker, school children are one of the groups that are most vulnerable in this time of COVID-19. With the opening of schools, much is needed to have been done to ensure their safety. Hence, the provision of PPEs is key, even before the enforcement of schools reopening. More than 2 weeks after resumption of schools, most people have been seen without face masks, hand sanitizers, while most of the schools do not have Veronica buckets of water for the pupils to use due to the lack of potable water. Schools with Veronica buckets do not have water in them, so they are just white elephants. Mr. Speaker, I will suggest that the President should take it up as part of the stimulus package to drill boreholes in all schools, especially those in the rural communities. And this will not only serve as a source of water for washing of hands, but for drinking by both peoples and community members. Mr. Speaker, a pandemic such as COVID-19 has not only taken a toll on women, but also brought out the creativity in them. Since the inception of COVID-19, women have played many important roles in ensuring that the virus is brought under control by creating quality health hygienic products needed in their communities. On realizing the lack of PPEs, women were very creative in producing face masks, hand sanitizers, hand washing soap, etc., as their contribution in fighting this COVID-19. But they do not have the resources to continue in this direction. Mr. Speaker, I would like to conclude by calling on governments, NGOs, and other civil society organizations to come out and support women in this heightened COVID-19 season so they can produce products that may help the community members and can protect themselves and also earn a steady income out of it. Mr. Speaker, if this is done, I believe it will go a long way in reducing the violence against women in our communities. I thank you, Mr. Speaker, for the opportunity.
Honourable members, since the three statements are on the same subject, I want us to take all the three, and then members will be invited to make their comments. So the second statement stands in the name of the Honourable Member for North Tong, Honourable Samuel Okujetu Ablakwa. Honourable Member, you may make your statement now.
Right, Honourable Speaker, I'm grateful to you for the opportunity to make this statement on what is undoubtedly of considerable public importance, particularly to the Ghanaian traveling public. Ghana's COVID-19 antigen test, which cost a whopping $150 United States at the Kotoka International Airport, remains one of the most expensive, if not the most expensive airport COVID-19 antigen test anywhere in the world. This amount, which is punitive and retrogressive, is leading to widespread agitation and incessant appeals from the general public for an urgent intervention, especially by this August House. Mr. Speaker, there is hardly a day passing without our constituents, Ghanaians in the diaspora, and members of the general public reaching out to us on the cutthroat cost, which they consider to be most unbearable, a view I strongly share and identify with. The public outrage has continued to play out on many media outlets. Mr. Speaker, in the wake of the current COVID-19 pandemic, one of the vital tools for risk minimization and to slow down spread of the virus has been the testing and isolation of infected people. According to the World Health Organization, the surest way to overcome this pandemic is to test, trace, and isolate. At the peak of the first wave, most countries closed their borders to ensure that infections were not introduced through travel. It soon became apparent that if steps were not taken for countries to be opened up, the aviation and tourism industries were going to be badly damaged, though other sectors of the global economy were not going to be left out too. Most countries therefore came up with a requirement for travelers to obtain a negative polymerase chain reaction PCR test for SARS-CoV-2 72 hours before they could board flights. As further scientific evidence emerged, it became clear that PCR by itself was not robust enough, because the procedure can take up to 24 hours for results to be produced. Passengers need to be given up to 72 hours to get the test done, and there is potential for new infections to occur or previously undetectable infections to show up in the time lag between testing and traveling. Following the development of newer, more rapid tests, countries including Ghana reviewed their protocols to ensure that an antigen test was undertaken on arrival. This was to ensure that any latent infections that were missed by the earlier PCR test were identified and isolated. Being more sensitive and elaborate, the PCR test must be run within a laboratory setting for 6 hours or more, with expensive equipment and requisite human resources. This makes it relatively more expensive than any of the other forms of COVID tests available.
First Deputy Speaker to take the chair. Please, you may continue.
This makes it relatively more expensive than any of the other forms of COVID tests available. At the start of the pandemic, the average cost of PCR was between $60 and $100. This has continued to drop, with the current cost ranging between $16 and $100. Mr. Speaker, the antigen test, which is what is sanctioned by the Akufo-Addo administration at the Kotoka International Airport, however, is a point-of-care test that is simple to administer according to the experts. They indicate that it relies on a fluorescent device or a simple cartridge, like a home pregnancy test kit, and is priced at between $4.58 and $12 on the international market. At the time when Ghana reopened its borders on the 1st of September 2020 and introduced the requirement for antigen testing, the stated price at the airport of $150 was justifiably considered by many who know that this technology is less sensitive and cheaper than PCR as expensive. However, government officials mounted a spirited defense and have since September last year maintained the $150 charge per traveler. Mr. Speaker, it is instructive to note that my research reveals that other countries run the antigen test at a far cheaper cost than Ghana. Respectfully, with your indulgence, a few examples will suffice. Malawi charges $25. Malaysia charges $28. India at the Goa airport charges $28. India at the Via Savarkar International Airport charges $7. The United Kingdom at the Heathrow Airport in London charges $70. Mr. Speaker, what is even more striking is the realization that the overwhelming majority of countries with the more superior PCR tests at their airports have charges that are shockingly far cheaper than Ghana's inferior antigen test cost. A few references. Togo charges $80 per PCR test. Sierra Leone charges $80. Senegal charges $75. Rwanda charges $60. Djibouti charges $28. Germany charges $70. And Turkey has only a $16 charge for a PCR test. Mr. Speaker, at the 58th ordinary session of the Authority of Heads of State and Government of ECOWAS, held on the 23rd of January 2021, and chaired by our President, His Excellency Nana Addo Dankwa Akufo-Addo, the performance of member states in the pandemic fight was reviewed. During this review, the harmonization of cross-border movements of persons and goods was approved. As part of this approval, it was agreed that PCR testing for travel within the sub-region will be capped at a maximum of $50 United States dollars. With this new development, Mr. Speaker, it is my considered view that the $150 per cost of antigen testing at Kotoka International Airport has become even more untenable. It cannot be right that the cost of antigen testing will be 3 times more expensive than the cost of the more sensitive and superior PCR test. I further submit, Mr. Speaker, that a look at the average wholesale cost of antigen tests on the biomedical science market is between $4.58 and $12. One may wonder how the cost to the end user will be approximately 12 times the wholesale cost should the upper value of this range be used. Mr. Speaker, on the 21st of January 2021, the Kingdom of Netherlands indicated that with effect from midnight of the 23rd of January 2021, travelers to that country will require an antigen test in addition to the 72-hour PCR test performed within 4 hours of boarding a flight to that country. Being a member of the Schengen area and European Union, it is likely that other countries in this group will introduce similar requirements. Air France has already done that. Documents available to me indicate that the company operating the testing regime at Kotoka will be undertaking this test too at the same cost of 150 United States dollars, which works out in terms of current exchange to 850 Ghana cedis. According to a notice by the airline KLM, travelers can opt to take the antigen test at Akai House Clinic on 6 Circular Road in Cantonments for 250 Ghana cedis. The question is, Mr. Speaker, why maintain this punitive $150, which works out to some 850 cedis, when the test can be run at much lower cost elsewhere, as we have seen being carried out at Akai House? And why is the antigen test not being made more widely available? Mr. Speaker, this, if not checked, could make travel to Ghana less attractive in this era of global economic downturn. As apart from the routine airline travel cost, passengers will require an average of $350 to $600 per person, depending on where the tests are carried out, for COVID-19 testing, just to make a return journey to Ghana. For a family of 5, this would translate to some $1,750 to $3,000 just for COVID tests alone. Mr. Speaker, reports are also emerging about how some travelers are forced to collude with officials at the airport in order to beat the system due to the exorbitant charges. The Ghana Medical Association has had cause in a recent statement to draw attention to loopholes at the airport because of this phenomenon, which is leading to further importation and spread of COVID-19. This is therefore rendering the entire testing policy at the airport counterproductive and clearly putting all Ghanaians at high risk as our case numbers continue to rise sharply. Mr. Speaker, equally troubling is a regrettable fact that this $150 exorbitant charge was not brought to this House for consideration and approval as the Fees and Charges Miscellaneous Provision 2018 Act 983 demands. There are also fundamental concerns about the lack of transparency and alleged breach of due process, not limited to flagrant violations of the Health Institutions and Facilities Act 2011, Act 829, when a newly registered entity known as Frontiers Healthcare Services was awarded a contract to carry out these antigen tests. Frontiers Healthcare Services is said to be beneficially controlled from the tax haven of the island of Dominica. Civil society organizations such as Imani have publicly raised alarm about these rather opaque arrangements. Mr. Speaker, I believe the time has come for this House to carry out its constitutional mandate of oversight by investigating all these matters as a matter of urgency. It is also absolutely imperative that we initiate concrete steps to cause a drastic reduction of Ghana's antigen test cost to align with international best practice. The punitive and retrogressive cost is greatly undermining the fight against COVID-19. May it not be said that this House sat idle by, as a few appear to engage in supernormal profiteering at a time when many lives are being lost to this global health crisis. Mr. Speaker, The government has also amended its original program of offering free COVID tests, except in very limited circumstances, of walk-in requests based on ill health, contact tracing, and exposure. Thus, according to a 27 January 2021 directive from the Ministry of Health, signed by Acting Chief Director Kwabena Buedu Oku Afare. And so, Mr. Speaker, virtually all the positive tests we are recording now are due to people who pay between 300 and 600 Ghana cedis to get tests done. We are thus missing a broad swath of Ghanaians who cannot afford the tests. And so we cannot get a handle of the problem until we can measure it. Unless antigen tests, which are cheaper and faster, are deployed widely across the country and made free in most cases to measure the scale of COVID in Ghana, we will be groping in the dark, for it is trite that what doesn't get measured doesn't get managed. Finally, Mr. Speaker, it is my fervent hope that the executive will be more audacious and ingenious, including deploying the use of advanced skillful diplomatic negotiations in securing vaccines much sooner than the 6-month timetable earlier advertised, as other African countries such as Seychelles have been able to achieve. The international community must understand that we first and not me first is the only solution to this pandemic. I convey deepest condolences to all those grieving on the loss of loved ones and wish all infected a speedy recovery. May we all continue to do our bit in a determined quest to defeat this ravaging virus. I'm most grateful to you, Mr. Speaker.
I'm advised that there's a third statement by the Honorable Deputy Whip, Lydia Sarah Molassen.
Thank you, Mr. Speaker, for the opportunity. COVID-19 nationalism and its impacts on Ghana. Mr. Speaker, in accordance with Order 2072, I rise to bring to the attention of the House an important matter of public health concern whose implications will be dire, barring any providential strategies to handle it. The matter, Mr. Speaker, has to do with COVID-19 nationalism and its implications for Ghana. I must quickly add, it is a matter that Honorable Okujeto Ablakwa touched on briefly the other day in his contributory remarks. Ever since COVID-19 pandemic ravaged the globe with its devastating health and socio-economic effects, there has been frantic global effort to produce a vaccine capable of providing immunity for humanity. Thankfully, Mr. Speaker, despite the emergence of a new variant of COVID-19 or SARS-CoV-2 virus that has sparked a second wave in many countries, including Ghana, some headways have been made. Recent announcements by pharmaceutical giants such as Moderna, Pfizer, AstraZeneca, and Gamaleya Institute of Russia on the mass production of the vaccines. We have a renewed hope of a possible earlier than anticipated conquest of the virus and a return of public life to normalcy in the shortest possible time. Mr. Speaker, it is important to state that it takes an average of 10 years for a vaccine to be developed. But the global scientific community successfully developed the COVID-19 vaccines in a record time of 332 days after the complete genetic sequence of the vaccine's virus was published. This remarkable achievement was only possible due to the extraordinary collaboration of unseen proportions among governments and scientists all over the world. While those groundbreaking developments represent a major step toward overcoming the pandemic, the unprecedented global race for the vaccines has resulted in vaccine nationalism and vaccine hoarding, which bear the potential to spell doom for countries in the developing world, including Ghana, who lack the economic muscle to compete with those in the global north for the vaccines. Mr. Speaker, the World Health Organization has already warned that Africa is in danger of being left behind in the rollout of COVID-19 vaccines as countries in other regions strike bilateral deals to drive prices up. It's also instructive to note that so far, Guinea is the only low-income country in Africa that has received doses of the vaccines, with only 55 people inoculated so far. Seychelles and Egypt remains the only African countries who have started a nationwide vaccination campaign. Clearly, Mr. Speaker, this paints a gloomy picture of Africans' recovery from the pandemic, notwithstanding the discovery of vaccines. This underscores the need for Ghana in particular to develop a comprehensive COVID-19 access and distribution strategies, which, among others, would ensure that 1. Collaboration with development partners in other African countries, both at the sub-regional and continental levels, for timely access to the vaccines. 2. An establishment of mechanism that ensures fair pricing and a resolution of monopolistic tendencies among local importers and wholesalers to avert unwarranted inflation of prices in the country. 3. A fair and equitable distribution which prioritizes hardest hit areas and vulnerable groups. And 4. The design of public education and sensitization programs to effectively deal with conspiracy theories which will lower public acceptance of the vaccines. Mr. Speaker, having said this, let me use this opportunity to commend His Excellency Nana Addo Dankwa Akufo-Addo, the Ministry of Health, Ghana Health Service, and the Ghana COVID-19 team for the proactive steps taken so far to ensure early procurement and receipt of the newly developed vaccines by the end of June this year. I am also informed that a technical committee has been instituted to oversee the rollout of the first batch of the vaccines. I remain highly confident, Mr. Speaker, that these measures, coupled with development of a comprehensive COVID-19 access and distribution strategy that factors in the aforementioned recommendations, would enable Ghana to overcome the pandemic. I am grateful once again, Mr. Speaker, for the opportunity.
Honourable members, I'll now admit comments from members on the floor. Yes. Now I can't identify you by your faces, but actually intended the honourable member in a smoke.
Thank you. Thank you, Right Honourable Speaker. Right Honourable Speaker, it is Clement Apak.
Oh, okay.
Member of Parliament.
I think we'll continue in that tradition. You identify yourself so that members can follow your discussion, know who you are.
Member of Parliament for Busa South, and your junior vandal from the great Commonwealth Hall. Mr. Speaker, I rise to commend all colleagues who have made very valuable and insightful statements today on various aspects of COVID-19. But in particular, I wish to contribute to the statement made by the Honorable Ladi Ayamba. Mr. Speaker, she has been very candid, straightforward, and has laid the facts as bare as she can. Mr. Speaker, it is just about 2 weeks since schools reopened. Mr. Speaker, even today as we speak, information available indicates very clearly from parents, from media reportages and constituents that there are still several schools which have not received PPEs. There are many other schools where they have received inadequate and or insufficient PPEs. We have cases of where certain schools have received Veronica buckets, nose mask, and don't have sanitizers and or liquid soap. So, Mr. Speaker, the situation is very worrying. If indeed we saw it fit to reopen schools after 10 months of closing them down because of the fear of COVID-19, why would we have gone on to reopen schools without first making sure that the bare and basic necessities would have been on site at the schools before students reported? So although the Director General of the Ghana Education Service yesterday, whilst taking his stand at the bi-weekly coronavirus update series at the Ministry of Information, indicated the supplies that had been made available in their tens of thousands, the truth is that that is after the fact. And the truth is that as we speak, those supplies are yet to get to several schools in this country. I would have wished that the Director General of GAS, the good old professor, would have gone on to even give us a breakdown as per the quantities of supplies sent to each region, sent to each district, to allow us to be able to report back accurately as to whether perhaps, in spite of his own effort, other subordinates who were expected to ensure that the PPEs got to the schools have been sleeping on their jobs. But as we speak now, in all honesty, there is a need, if I may suggest, for teams to be put together to monitor and report back so that we can be sure that all the monies being spent and the quantities of PPEs that the Director General indicated in their tens of thousands as having been distributed have indeed gotten to where we expect them to be. Mr. Speaker, the other issue of concern, and as far as COVID-19 and our children goes, is this. Several of our public schools are overcrowded. We have heard reports of an introduction or reintroduction of the shift system. But how effective that has been is yet to be ascertained. As we speak, we have reports of classrooms hosting in excess of 80 students. Truly, how do we expect there to be physical and social distancing in a classroom that is hosting 80 students? clearly we cannot expect our wards, as young as they are and as confused as they may be, to be able to abide by the protocols when we do not create the requisite environment for them to do so. In addition to that, there are instances where the classroom sizes may not be that big, but as a result of a lack of adequate furniture, you have students clustering on dual desks, which traditionally are designed to seat 2 students. You have 4 students sitting on a dual desk. How truly do we expect the students to be able to abide by physical and social distancing? It is my candid opinion that since we are not in usual times, we could look beyond just the introduction of the shift system. There is no reason why, as we have done as members of parliament, having left our chamber for the sake of safety and for the fact that we seem a bit more crowded in there, to this extent, there is no reason why that cannot be replicated in the schools that have higher populations. After all, in difficult times, when catastrophes hit, refugees are provided with tents. Here we are in a tent. So may I humbly suggest that government and the GES should consider erecting tents in those schools where the students are many, and to provide furniture so that our wards can also be safe. Hitherto, we had the impression that by virtue of the robust immunity of our kids, they could resist or withstand the virus. Only yesterday, reports from the Konfanochi Teaching Hospital indicate very clearly that that is no longer the case. Children as young as 11 days old, 14 years old, are on record to have contracted the coronavirus. Mr. Speaker, if there was ever a time for us to expend our resources in the interest of Ghanaian citizens, this is the time. Thank you for the opportunity.
Honourable Member of Fijase Asokore.
Mr. Speaker, I rise to comment on these statements ably submitted and presented by members of this august House. Mr. Speaker, it touched on various areas. In terms of the effect of COVID on schools, it was revealing for the honorable member on the other side to state the effect of closures of schools on feeding, and that presupposes that about 24% of children who couldn't access school feeding opportunities during the period of closure indeed would suffer some level of malnutrition. So consequently, the closure of schools imperiled the nutritional level of some children in various parts of the country. Sad as it was, those actions, I guess, was absolutely necessary to have been taken. It is indeed gratifying that we have the students coming back and schools have been opened. In that regard, one would expect that arrangements in terms of feeding will be adequate, available, and unconditionally accessible by all these children. Where we should also condemn most is violence that was meted to women and children during this period. But for child labor and also other reasons, you are worried to know that from the report, during this period, such persons we consider vulnerable as those women and children were subjected to some level of abuse. Mr. Speaker, with your indulgence, I crave that you would want to get the appropriate institutions to give us any statistics whatsoever and what they have done about persons who subjected loved ones to such torture. For the issue to do with schools reopened and some of the verandah buckets don't have water in them, it is also a source of concern because we all know the consequent effect, spread of diseases through waterborne illnesses. I am aware that through the measures of government trying to make water available in communities for free, some MCAs and DCAs manage to get water in various rural parts of the country. And for that matter, for schools in those communities, they can access them. And I think that assemblies have the august responsibility to make sure that schools have water adequately stored and available for kids during school reopening. Indeed, it is also worrying if the assertion is true and confirmed that some buckets find themselves without water. I was looking forward to the Honorable Robert to have made an example, but I think that yes, she can find, or Mr. Speaker, you can find a way to grant ahead a hearing to make mention of some places, probably after closure. So adequate steps can be taken and kids should access water, which is mandatory. But to talk about the issue with antigen testing at airport, Mr. Speaker, we will commend government at first hand because at the time that they introduced antigen testing at the airports in September, many countries have not started, and therefore Ghana stood to be pace setters, especially as it was the first week of September. By and large, several other countries joined, and that is to say, we had a visionary president, a very able task force, solid ministry who was supportive and brought the idea for testing. Indeed, persons have tested in their countries with PCR, but they arrived with positive cases identified amongst them. Also is the issue of certification. Because of the absence of a unified platform, persons, I'm sure, are finding themselves to present all manner of certificates. And that undoubtedly would allow people to get access into the country or even out of the country, probably haven't tested for COVID, but then it will show they are negative. And the absage clearly shows that there is some level of inefficiency, and I would think, to add to the position of my colleague, there's a need for a unified certification as urgent as it should be, whether you are going out or you are coming in. But to do with the issue of pricing, and as much as I commend the government for this innovation, I would say that your committee did not have the opportunity to meet stakeholders to find out the reasons for the costing. And as a health economist, I would not delve into saying or hurriedly to say that it is expensive unless when your committee has a chance to meet stakeholders. Mr. Speaker, in as much as you are in a hurry to set up your committees, I know that when your committees are established, your able committee of health, which you have able men and women who do a very good job, will definitely invite all stakeholders and present appropriate report to do with the cost centers and while they arrive at $150. But that is to say, I'll still stand and commend my colleague for recognizing the feeling of some persons and their concerns. But then, given opportunity by you, your committee will do that job and we can advise appropriately. With vaccines, the good president of this country, on his briefing, told us that they are trying to source the COVAX facility, which is a WHO, Gavi, AMC, is an initiative that will allow for participating countries to benefit from 20% of doses correlated to their population size. So to say Ghana having a population of 30 million, we probably stand to enjoy about 6 million doses. And that will come at the end of the first quarter. That will make available doses for frontline workers and other essential people and also vulnerable people in the communities. I would say that we have to be firm and believing in the assurances of the president, who has been on top of the management of COVID, who has been cited so much in various countries. And as much as he has spoken, it will be delivered. And so we're looking forward to the end of first quarter to have the doses as such. So, Mr. Speaker, before I take leave of this position in my expose, I would still take the chance to thank the makers of the statement. It is brilliant, absolutely brilliant. And thank you so very much, Mr. Speaker.
Thank you. Thank you, Mr. Speaker, for the opportunity to add my voice to the three statements made by my colleagues, and especially on the statement made by my senior colleague and mother, Honorable Hajia Ladi, on women and children. In adding my voice, Mr. Speaker, I must say that the COVID-19 pandemic has brought a lot of hardship onto women, as stated in Hajia's statement. Today, women have the responsibility to provide PPEs for children. And as we are all aware, children, as they play around, some of them end up throwing their PPEs away, their nose masks away, they might misplace it, and the mother will have to go and look for a new one. That costs a lot of money to that rural mother. Mr. Speaker, there is no contact tracing specially available for children and their mothers. Mothers, some of them are able to fend for their family by selling in the markets that are already choked or crowded. So there must be a way to trace those who are infected and then those who are not infected. There must be a special program for women and children in this very critical time. Mr. Speaker, there is also a very serious thing that we have to look at. The children that are supposed to go back to school and the teachers. What are the special arrangements for them? Is it just going to be providing nose masks and that will be all? Or there will be health professionals in the schools who will be guiding and helping the teachers to really provide care in a way for these children? Mr. Speaker, if we fail as a country to do or to provide our women and children special opportunities for this pandemic, we will end up having a lot of cases in the country. Mr. Speaker, I know you talk for us. I know you are interested in our matters. I mean women and children. Please, the committee that my colleague just
spoke about, I would like to add my voice to or support what he has said, that Mr. Speaker, set the committee up, add women to the committee, and let's talk about ourselves. On that note, I thank you so much, Mr. Speaker, for the opportunity.
Yes, member.
Thank you, Honorable Speaker. Kingsley Nyako from Kwadaso constituency. Mr. Speaker, it is true that COVID is ravaging our homes, our families, and our societies. In my respected view, the government and the president have done so well by putting in interventions to deal with this unfortunate pandemic. My observation has been to the fact that our attempts in addressing this pandemic have zeroed in mostly on behavioral measures like washing of hands, wearing nose masks, sanitizing our hands, and all that. These are psychological variables that are very important. But there are other psychological interventions that it seems we've not averted our minds to. For example, stigmatization. And that is due to the fear and anxiety persons who suspect of having this disease don't want to engage in, because they are afraid that when it comes out that they have COVID, they will be stigmatized. That prevents most people from going for testing, and that is worrying. This same stigmatization makes some persons engage in unacceptable practices, resulting to unorthodox ways of dealing with this disease that can in fact have egregious consequences on their being, and that will be also to the cause of the nation. So I hope that our education intervention should also look at some of these variables that can help us to contain or deal with the COVID-19 pandemic. Mr. Speaker, one other point I also want to make is about post-traumatic stress disorder. This is one's inability to recover from an unpalatable experience or event. And this has very negative effects on persons, especially children, who saw the demise of persons who are very close to them. My question is, what have you put in place to ensure that children and young adults who have experienced the demise of somebody affected with this pandemic to cope? It's very important, because if that is not done, it can disrupt their thinking patterns that will prevent them from pursuing their education, study, and all that. So as much as I commend the president and the government for the good work done, I'm also trying to plead that we avert our minds to not only the outward behavioral practices, but also some cognitive practices that will help us to deal with this particular pandemic. COVID-19, some people say it's a blessing, others say it's a curse. Whichever way you look at it, curse because it has caused a lot of havoc to society. Blessing maybe gives us the opportunity to do something new. It's a new normal. We have to live with it. But you must also understand that it gives us the opportunity to do things anew, things that will help the collective progress and development of this country. On that score, Mr. Speaker, I humbly thank you for the space given me. Thank you.
Doctor, yes.
Thank you, Mr. Speaker, for giving me this opportunity. I want to thank the makers of these statements on COVID-19 and have this to say. The current conditions that we are living in, especially after the elections, is worse than before. When I say worse than before, I'm comparing it to the COVID conditions before elections. Yet we are walking that tightrope of living a normal life. And that is why we've got to make the decisions to have our children at school, recreation, football, etc. is still going on. And of course, the sitting of Parliament and industry is still working. However, Mr. Speaker, the conditions have changed. I'm saying this because currently, if I had it right, you can walk to any public health laboratory and have the COVID test carried out. Then the golden question we've got to ask ourselves is, why are we still charging $150 at the airport? My colleague came to paint a picture as if things are not good, things are still worse. But why should we still pay $150 if the ordinary Ghanaian can walk to a public health facility and have the test? We should remember that those arriving from abroad, majority of them are our brothers, our children, our own people. I don't know who we are exploiting, but if you buy your own tank and think that you're chewing it, you've done practically nothing. Mr. Speaker, the other thing I want to comment on is the vaccine. I've heard that there's a timetable for us to have the vaccine in 6 months' time. And my good colleague, Deputy Chairman of the Health Committee, also mentioned. Mentioned that there's an international plan to supply 20% of the population, and he estimated it at 6 million. But we've gotten to a stage where we've got to take our own destiny into our own hands. There are problems with this international supplies, etc. AstraZeneca is not meeting the European Union demands. A lot of countries are making their own effort, and even a country such as what? Guinea. I'm saying so because we know that Guinea, comparative to us, we might even be higher than them, Mr. Speaker. They are making an effort, even though the number is small. Mr. Speaker, we have to take our destiny into our own hands. The 6 months is too much. It's far away. I am calling for vaccines now. Thank you, Mr. Speaker.
Vaccines now. Vaccines now.
Yes, Honourable Member. Yes, Dr. Free is all right.
Thank you very much for the...
Dr. Efrie Kwaku
Serioso,
yes.
MP for Serioso. Mr. Speaker, thank you very much for the opportunity, and I thank the various makers of the statements for bringing this problem to the fore of Parliament. Mr. Speaker, I think they've covered a wide area, the social aspect of it, even the vaccine prevention aspect, and even the sociology with regards to children as is playing out there. Mr. Speaker, we are in difficult times, and we do not have a handle on all the parameters. Indeed, some of the problems seem even paradoxical. Let me give you an example. when schools were opened previously for, I think, those who were bound to do examination, there was a hue and cry in this country when there were sporadic outbreaks in several places. Turned out that in the final analysis, schools turned out to be the most secure places to have your children in. But now we are in a new vista, and we have scaled up the, as it were, the children going up back to school. And there are toddlers among them who cannot be trusted to observe all the protocols. Mr. Speaker, in spite of all that is happening, I think we have to get our perspective right and not get into panic mode. Yes, we have a clear incidence of rising infection, but we are not in the European and American proportions yet. And now I'm not suggesting that we should read there before we take action. Mr. Speaker, we have some knowledge as to what we should do. I want people to avert their mind to the fact that if we decide as a nation go into reset mode, and even with the tools and knowledge that we have, we can, in double quick time, we can bring the numbers down. I'm not even suggesting that we should have we should go into a lockdown. But conceptually, if you are not close to anybody, you cannot get the infection. If you imagine that you live on an island and you are not close to a neighbor, you cannot get infection. If willy-nilly you have to be close to somebody, then it means you have to adopt all the barrier measures that you can master, so that if the assumption is that he or she has the infection, it cannot be transmitted to you. That knowledge should go to the people, and we should make sure that everybody understands that, so that even if we are having funerals, people might not take risk. Mr. Speaker, I'm suggesting that a lot of people have not digested this knowledge, and they have some woolly knowledge about even the transmission of COVID. If we give that kind of knowledge to people, I'm sure that they can take care of themselves. Mr. Speaker, if you look at the geographical distribution of COVID, you see that it is an urban phenomenon, even though there are sporadic cases in the rural settings. So that our approach should be that those areas that COVID has not touched, we should maintain them while we take care to deal with the situation in urban settings such as Accra and Kumasi and elsewhere. Mr. Speaker, even in Accra, it is very strange that places like Choko, Koregono, and others, for some strange reason, those people are packed together, and yet there's minimal spread. It is because of the outdoor life. Here, we are saying that we are maintaining social distancing, but we are living in an enclosed capsule. And I'm suggesting that empirical thought, that because we have social distanced ourselves and yet we have encased ourselves in this kind of casing, might not exactly be good for us. In this sense, I recommend that we should even, as far as school children are concerned, that concept that we jettisoned, school under trees, we are in the dry season. I'm suggesting that as far as possible, schools should be organized under trees now, because the body of empirical evidence suggests that when you stay in non-enclosed spaces, you don't get infected. That knowledge must be put to good use. In that wise, we are in a better place than those in temperate climates who are in winter time now. But Mr. Speaker, because I take at my seat, the last maker of this, the MP for Ayo West Wogon, made some very, very succinct observation, which Africa, and for that matter, Ghana must take care of. This idea of what she called vaccine nationalism, it's a big phenomenon. It has always been around for a long time, as far as medicines are concerned. And I'm suggesting that as far as COVID-19 is concerned, it should go there to get into the idea that indeed vaccines are security issues. In fact, Africa is harboring some of the worst pathogens that are left in this world. neglected tropical disease, Borrelia ulcer, tuberculosis, the last vestiges of tuberculosis, Hansen's disease, that leprosy, and all those things are still around us. And even our good old malaria, we still don't have exactly a good handle on that. But all those medications and medicaments are coming not from Africa itself. Mr. Speaker, I suggest that we have the knowledge, we have the know-how, we have the capacity. It is only that we are not organizing ourselves well. So I'm advocating for a Pan-African approach, or at the very least an ECOWAS approach. Nigeria, Ghana, Senegal has the capacity to go into this vaccine development. And in double quick time, I believe that we can come out with something which might even surprise the world. After all, the very idea of vaccination emanated from Africa. Variolation. Time was in the past when anybody who had smallpox, anybody who was recovering, convalescent patients, they took part of their plasma and they did scarifications, inserted it in them, and then they had a mild form of smallpox, and that was knowledge was taken by slaves to the Americas and Europe, and that was the beginning of vaccination. People do not know that. All this body of knowledge started from Africa, and we have a moral obligation to contribute to the body of knowledge in this world. Resource poor as we have, I don't think anybody is more intelligent. When God was distributing intelligence, he did it equitably. So let's get our act together. The capacity that we have, let's revamp them. Let's hold hands. Ghana, Nigeria, Senegal, I can get them. And task our scientists to do that. And when it comes to commercialization, I believe that the commercial people and the economists can make sure that we can move it from the realm of commercial activities so that we may not rely on the people who have medicalized diseases, especially tropical diseases, and reaping profit off us. Mr. Speaker, I didn't say that they have covered a lot of areas, so if I were to continue, I'm sure that I will end up giving a lecture. But suffice to say that COVID is providing a challenge, and I see that we can make a dent and chart a path that can even touch on the way we even organize our economy, so that we can emancipate ourselves. Thank you very much for the opportunity, Mr. Speaker.
Yes. Mr. Speaker, thank you for the opportunity to add my voice to the three statements that have been made in respect of COVID-19 today. Mr. Speaker, I want to draw the House's attention to the sheer nature of our public transport system and the nature of spread of COVID-19. Last year, directives were issued to public transport owners to reduce the number of passenger intake, for instance. But that was reversed before Christmas. And no such directive has been issued again. And we are told by the experts that the new variant is more deadly. So I want to urge the government to do something in that regard. Mr. Speaker, last year, directions were issued in respect of how funerals should be organized as to numbers. We have increasingly veered from that. Today, funerals in our various localities and communities are increasingly being organized in large numbers. And again, it's a fatal ground to increase the rate of spread among ourselves. Mr. Speaker, we are told that PPEs and other essentials have been distributed to schools. But in Southern, as we speak, I have 15,000 school-going children from secondary school to kindergarten 1. Mr. Speaker, we have only been given hand sanitizers and paper tissue, no face masks. no Veronica buckets. Veronica buckets that some of us contributed in distributing last year have outlived their usefulness, especially because they are mainly made of plastic, and because they've been sitting in the sun for a long time, they become brittle. So I have reports that a lot of them have broken. And so there's a need for a new set of Veronica buckets to be distributed to the schools. And the use of the face masks. But the authorities in the district are telling me that they have only been given paper tissues and hand sanitizers. And the emphasis today, Mr. Speaker, is for us to use the face masks as much as we can. And so I want to urge the GES to, as a matter of urgency, ensure that the face masks are distributed to the school children and the teachers. My brother, Chief Vanda, Senior Park, he spoke about the large numbers in our classrooms, and it is a fact, Mr. Speaker. Even in Parliament, we have instituted arrangements to run a triple track system, not even a double track. So why are we encouraging the schools?
Honorable, you will be quoted. So kindly explain what you mean by triple track before it causes confusion outside.
Mr. Speaker, I'm guided. Now, the system Parliament intends to operate to ensure that we operate effectively in the COVID-19 era is to ensure that members are divided into 3 sets of groups, so that at any given time that we are in session, one batch will be here and the rest of us will be in our offices and participate from there by way of virtual participation. And when it is time for decision making or when resolutions will have to be passed, then we can descend into the chamber and do so. And that is a good arrangement. It is better than shutting down the house. So by parity of reasoning, Mr. Speaker, my point is that we need to ensure that the schools also, or GES, come up with some similar arrangements, so we don't pack our school children in the classrooms in these dangerous times. Mr. Speaker, the last point I want to make on this matter is as regards the arrangement that exists in our police cells. I was called yesterday to attend to a matter, and it took me to one of the police cells in metropolitan Accra. Mr. Speaker, the sheer number of suspects that are still held by the police on some flimsiest of charges. Some as simple as somebody has been spotted not wearing a face mask. And so instead of the police taking steps to ensure that the person wears a face mask and maybe admitted to a bond of good behavior, the person is rather placed in a police cell in a confinement. And it's a worry, it's a situation that for me should worry all of us. And so I want to urge the Ghana Police Service to, in these times, desist from using the old tactics of holding suspects in confinement such as police cells. For it is also a fertile ground for spreading the disease. And so, Mr. Speaker, with these few words, I want to thank the makers of the statement on the very important matter of COVID-19. Thank you very much.
Honourable Member for Buakwa South.
Thank you, Right Honourable Speaker, for the opportunity to contribute to the statements on the floor, which, for some good reason, they all converge on one point. how this debilitating disease is affecting the whole nation. I'm glad that the convergence is good, coming from both sides of the aisle. It seems to me, therefore, that we can agree on matters which have common consequence for the entire nation. I believe that is what should define our parliament, that COVID does not wear party colors. There are several issues affecting this country which do not wear party colors. The poverty that is mocking us, the future of this nation and the rest of it, we should tread this path. And that is when we become the gatekeepers of development and democracy. I'm very, very excited about that, and I want to commend Honorable Okujeto Ablakwa, Honorable Lady Ladi Ayaba, Honorable Lady Alhassan Lydia Saram, for putting together these very important statements. Honorable Speaker, I think we should credit President Nana Akufo-Addo with the competence to also handle this upsurge. If you measure what was happening in the United States of America when the COVID-19 reared its ugly head, it was very obvious that we had a Ghanaian, or if you like, an African president who was doing so well, measured against Donald Trump of the United States of America. Now we have a spike. The test of leadership is competence. And when problems are so serious to handle, and we're able to do so, that's a test of leadership. Not when you are in your salad days of presidency and there's nothing serious which come to test you, that we should measure you. The measurement of the steel and the capacity of our president is now. There's a spike, there's an upsurge of this COVID thing, and we know he will rise up to the occasion. I think my colleague, Honorable Okujeto Ablakwa, touched on a matter which is very dear to my heart. But, Honorable Speaker, we have a tendency to exploit situations. I do not see why anybody should make a commercial kill out of this pandemic in terms of where you go and test, or there's a special arrangement that these are the houses of science which are set up, or laboratories for testing, for purposes of giving undue financial advantage to any individual. If there is any arrangement of that nature, I think we should investigate it and ensure that nobody takes undue advantage of the situation. One other issue of his emphasis was how we are testing less because of the price. He didn't furnish us with scientific evidence, I felt, but if because of poverty or by reason of the fact that we are unable to pay for the test, we are testing less, it seems to me that then we are deceiving ourselves. If you don't have tests which measure up to those who have contracted the disease, it's a deception that the nation cannot afford. So we should do more testing, so we have the numbers, and that is what we should do. Now, almighty vaccine. I find it interesting when my colleague, the doctor now turned the serious politician from the Western region, was talking about we should come out with a vaccine that will affect the world, and that the scientists of Africa should come together in this huge enterprise and or undertaking. I beg to differ. I do not know the number of scientists we have in Ghana. This country is a very serious country in terms of intellectual prowess and the rest of them. We do not lack. If you look at the UN and the World Health Organization and all international bodies, we always field world-class scientists. I believe, and I want to submit, that probably the bigger your trouble, you should also develop an ingenuity to defeat the trouble. So I want to urge our men of science, this is very opportune for us to say that Ghana has developed a world-class vaccine that the United States of America would want to import. I believe we should be able to do that. I believe, and I challenge Ghanaian scientists, that it is a bad situation we find ourselves in, but it can also be a God moment for us to be a net exporter of vaccines to help the world, and by some measure also enrich the economy of this country. I want to touch on the last point, which I believe is very important. The preparations to ensure that children are not further endangered. That's a very valid point to make. Nobody should send a child to school to go and contract this disease, and the consequences we can't guarantee. But I'm afraid when it is starting in any undertaking, it doesn't start with everything intact. I just even heard that in our tallest year, the third arm of government, the tallest we don't have enough paper napkins and the rest of it. It seems to me that when we are beginning anything, you can have some hiccups. So we should be up to it. But I would want to urge parents. I do not see why you deliver your children to schools without you showing the generosity of giving your child some of the requisite needs to fight this COVID. How much does it take to buy your own child the face mask until every supply they need is provided? So in the meantime, I'll plead with members of parliament to monitor the secondary schools in their area. Very, very important. If it's possible to donate some of these face masks, fine, it's good. But parents, I'm of the view that parents should be very vigilant on it, and should be the first volunteers to give voluntarily some of these face masks to our children to protect them. Because I am fully persuaded that President Akufo-Addo is on top of the issues, and because we are doing it for the first time, that let's take them back. There will be hiccups, but we shall overcome all these challenges, and Ghana will be better off for that. But what is dear to my heart, that the scientists of this country, the men who understand chemistry and the rest of science, should rise up to the occasion and deliver to this dear country of ours the first Ghana-made vaccine of international class for every country to come and import from us. Thank you, Honorable Speaker, for your kind indulgence.
Have one more opportunity at the back.
Thank you, Mr. Speaker. Thank you, Mr. Speaker. Thank you to our honorable colleagues who have contributed very significant statements on the issue of COVID. But, Mr. Speaker, we are running against time. COVID knows no timetable, and there's no time. So we must be extra vigilant and proactive. Both as a government and all the arms of government have to be up and doing. Mr. Speaker, there is not enough education in the districts on the COVID. I know the NCC is under-resourced. In my constituency, I've had to help NCC even to buy fuel, to take the vehicles around, to go and announce COVID and all that goes along with it. And I'm sure that I'm not alone. Something has to be done about that very quickly. Information needs to go out. There must be a public-spirited public relations campaign on COVID. If we are moving to a higher gear, a higher level of disease in which there are a lot of gray areas, because at least the first one that came in March, we have kind of sailed through it a bit. If this one has higher consequences, the public needs to know. Sometimes people just need to be reminded. As the children have gone to school, if it means that Ghana Education Service has to look at ways and means to educate the kids, whether through cartoons or any other teaching aids on COVID. That has to be done, and done very quickly. We cannot afford to lose our children at any age just because they do not know enough. Mr. Speaker, in addition to that, the basic dietary changes that have to be made are not being trumpeted enough. I've personally had to touch on it when I'm going to churches, just to tell people to eat more fruits and vegetables. And maybe they do not see the urgency or the reason why they have to increase that intake, because maybe they're already doing it. But we need to let people know that if you do this, this is the consequence. If you eat more fruits, it's going to build your immune system, and there's no other way to do that. In addition to the basic drugs of, I'm not a pharmacist, I'm not a doctor, but permit me to mention vitamin C, zinc sources, and vitamin D. Those are what we are also being told, and the least we can do is let more and more people know that that is what they must be taking. Mr. Speaker, please, we are in serious times, and we cannot afford not to be proactive about these issues. The public need to know and need to advise themselves. The days of us feeling that we are on our own because we have been advised during the president's addresses is not enough. Even though perhaps flyers will go around on social media right after the address, the person in the village, Antiama in the village, has not seen the flyer. She has not heard the president's address. She does not know what to do next. So please, a public-spirited, public PR campaign has to be stepped up on COVID, and this must be done with utmost urgency by the holders of information in this country. I thank you very much.
The last one will go to the minister. Former Minister for Health.
Thank you, Mr. Speaker. Mr. Speaker, I'll crave your indulgence to remind you that I'm the minister designate that will soon come to sit in front of you for vetting.
Cross that threshold. Well, now you are behind the threshold.
Thank you, Mr. Speaker. Mr. Speaker, let me first of all thank my colleagues who made statements that has allowed several of us to also contribute. And I want to join the group that contributed to also say a few things. We have come out with a lot of issues on COVID-19. One of my colleagues, Hamid, has said that the current situation is worse than before. Yes, that is correct. Transmissibility is far, far, far bigger than previously. New variants have been announced. We've detected in Ghana. And the severity of illness is even becoming quite worrisome. And these are issues that government has started addressing in a little bit different manner. We saw COVID. We triggered communication around the country, information dissemination. We continuously were saying that the disease has come to live with us, so we should learn to live with it. And we learned a lot. One of my colleagues was talking about public transportation. The sort of initiatives that were taken have been dropped, but people are taking voluntary initiatives to do what we were doing earlier, that for some reason we went down to relax. Transport associations have started announcing themselves and placing restrictions on themselves in their lorry stations, said that people should not board their vehicles without masks, and they are providing sanitizers and Veronica buckets have been triggered. In lorry stations, they themselves, yesterday we heard from Eastern region, the Bono region, the Bono East and things like that. So citizens are living up to the task to support government efforts and government initiatives. Mr. Speaker, I know, and this was announced and they made a press by the Ghana Education Service, close to about 23 million face masks have been ordered to be supplied, and distribution is ongoing. In some places we have served adequately, In some places, like my colleague said, things are yet together. But we have triggered monitoring to follow up to make sure that every district has got what has been allocated to them based on the population of children. And I like what my colleague, the honorable member from, is it Chibi or Wapasaf? Honorable Atacha, said that we should also play voluntary roles as parents and citizens to complement the efforts that government is actually making. Mr. Speaker, there are arrangements for classrooms to be decongested, and these guidelines have gone out. Teachers have been trained, said that in classes where we have large numbers, they will break them into two and begin to run some semblance of a shift system so that we don't actually congregate these students against the protocols that we have actually initiated. But Mr. Speaker, I've taken notes of all the recommendations and the good suggestions, said that at an appropriate time when I get opportunity, we will put them up, and I'll also advise the COVID Command Center, that is in the Office of the President, about your views and the observations that you have actually made. Mr. Speaker, let me respond quite mildly to the cost of the COVID vaccines. Yes, indeed, my colleague from Northtown mentioned the ECOWAS protocols and the review issues that has actually capped the test at the borders to $50. The President has actually given orders that we should quickly make implementation modalities to try to see how best this can be implemented in our country. And I believe even if at least equal citizens will be able to access the test at the airport at the $50, as has been agreed by the ECOWAS community. But the $150 they didn't come for nothing. Mr. Speaker, the infrastructure that was put at the airport to try to do this test efficiently was quite unparalleled around the whole world. People who were traveling across Europe and America will come and will testify to this. And all these things come at a cost. But we're taking a good look at what is now on the board, and I believe things will begin to ease up a little bit for us, and this will be looked at favorably. Mr. Speaker, we were battling with antigen tests initially, and the FDA was restricting, and the scientists said that we wouldn't use antigen tests. But looks like now, new antigen tests that have been certified by WHO have been tested, and its sensitivity is gone quite high. So I believe very soon this will come on board, and we may see antigen tests being utilized in the country. A day or two, and Honorable Abrakwa also mentioned that the minister's release that is emphasizing that the test is still facilities. This walk-in concept came about as we're being demanded to do tests and present certificates before they can fly. Right? That is how come walk-ins came in, to try to reduce the time for them to get it quicker. But all public facilities that are doing tests are still doing tests for free. Only that some of us want to go and do our test and get it very quickly, whether we are traveling or not. And that is how come we are saying walk-ins and the charges. But we are re-emphasizing that every single public place should not charge any amount of money for the test, to make us more efficient in trying to fight the battle. Mr. Speaker, I want to speak long on these matters after I get appropriate time going forward, as soon as I cross the bridge, like you said. I may seek opportunity to come and brief the House on the situation on COVID. But a few things I want to say about the vaccine. Mr. Speaker, the time is now, and as I speak, there's a meeting going on in Jubilee House on vaccines. About 3 days ago, we are meeting with vaccine manufacturers. We are doing all that we can. We are doing quantification by the numbers. We are looking at sources of funding to be able to do what will bring us the vaccines as quickly as we can procure them. The bad news is that the whole world is placing orders for vaccines. The rich countries have placed a lot with manufacturers to even support them to expand their facilities to produce. Yesterday, the president was admonishing that we should begin to look at possibilities of us trying to manufacture even some of the vaccines in country or partnering across the West Coast. The AU has actually set up the African Medicine Supply Platform, where we are trying to source some of these vaccines from. We have indications of quantities that have been reserved for Africa, and they have allocated for us. So we believe that very soon we may get stocks of these vaccines in country. We may not pick from only one manufacturer, but look at what WHO has certified and what our FDA will advise us to go for. And we are making very frantic efforts to try to get the vaccines here. A vaccine strategy has been developed already, and we are planning rolling out the activities for implementation as quickly as we can. One of it is the procurement of the vaccines that the finance minister and myself are trying to work on with a small group that is assisting the president to actually move faster to make sure that we have the vaccines. We have to do a lot of communication. Risk communication fund has been triggered. We have to be meeting with NCC and the Ministry of Information to try to see how we can fight the situation of vaccine hesitancy, and then look at the mobilization implementation arrangements. So Ghana Health Service is on it, also working to make sure that we can get it done. Mr. Speaker, the good news is that when we're doing the yellow fever campaign, the Ghana Health Service and the immunization group were able to do vaccinations for 6 million people in 2 weeks. So I believe if you get good doses of the vaccine, as for implementation, we wouldn't have so much problems with it. We can mobilize and move to mobilize the 30 million or so that we have in our country in a very good time. Mr. Speaker, I don't think I will need to say so many things again. I've taken note of all the good things that my colleagues said, the deficiencies that they have identified and they brought out for correction. I will carry this up and we'll see how best this will help us fight the battle. Thank you very much, Mr. Speaker.
Very well. Now leadership. Honorable Deputy Leader.
Thank you, Mr. Speaker. Mr. Speaker, I rise to also thank the makers of the statements on COVID-19. I think, Mr. Speaker, this is a very important statement, and you could see from the contribution from members, because this is a disease that when it was first announced in November 2019 in China, we here in Ghana did not know that a day like this we'll be talking about the disease and what we do as a country. We thought it's something that will not even come to our country at all. But Mr. Speaker, here we are today talking about the virus. Mr. Speaker, the whole issue can be categorized into 3 or 4 main areas. The first one being, how do we prevent the spread of the virus? The second could be the testing of the people of this country to know who and who tests positive. And the third one could be treatment. So, Mr. Speaker, at each level of this categorization, the state has a role to play as well as the individuals. Now, Mr. Speaker, you'll be surprised to know that in some part of this country, our people still don't even believe that we have the virus or we have the disease. Some still don't believe it. So, how do we make those people to know or to believe that there's a virus called COVID-19? The state must play a role. That is where the NCC comes in. You go to your constituencies, the NCC is completely dead. They don't play any role. You don't see them moving around to communities to educate the communities on the existence of the virus. You don't even hear them on local radio stations to educate the people on the virus. So, for the people to know and believe that the disease exists, and for that matter, they have to make effort to prevent the spread, they must first hear from the state institution, and in this case, the NCC. So we have to take education very serious. People watch and listen on radio, watch television stations, but most of the time the question that some of them ask, especially the rural folk ask, is that, have you ever seen any dead person who said is killed by COVID-19? That's the question they keep asking. Because we said 377 people so far died COVID. They don't believe it. Because they have not seen that this person died out of COVID. What do we do for them to believe that this death we are talking about, the number we are referring to, actually are killed by the disease? So, Mr. Speaker, there is more to do by government for the people to first of all believe, and once they believe, whatever you ask them to do in terms of the prevention, in terms of the social distancing, in terms of the wearing of the face mask, the nose mask, they will take it serious. Some of us, when the issue came out first, on our own had to fall on our local seamstresses and tailors to sew the nose mask for our people, which was shared to them. But you don't even see them wear it. They collect the nose masks, put them in their homes, they don't wear them because they don't believe that the disease is there. So, education to me is key and very important. That will be the first effort we should make towards the prevention of the spread of the virus. Now, Mr. Speaker, when you come to the testing, a lot have been said by other contributors on what government need to do, and it's commendable that government has now asked that the testing center that for the state should test people who just walk in for free. We need to encourage our people to go and do the test. And Mr. Speaker, we must show by example. We here in this house are saying that we should test, but our own selves are being asked to test, and the Speaker, you keep announcing all the time that members should go and test. So we have to show leadership by example. We should go and test ourselves so that we can know our status, so that others can also follow. Now, there are people who on their own also go to test and pay, and they are also commendable. And Mr. Speaker, that will let us know the number of the cases that we are reporting on. We are talking about 3,000 active cases. Mr. Speaker, if proper testing is done, the number will be more than that. The number will be far more than that. But for now, because that is the only number which has been tested, and that is what we have, we are talking about it. We think that the number is the active cases is only 3,000. But, Mr. Speaker, we could get more than that. So, we need to encourage our people to do more testing, and government has a role to play. Then come to the treatment. The people who have been tested positive. How are we treating them? Is that a way that if our hospitals cannot even accommodate the number, people can even stay home and be treated at home? And we see a number of issues said on the social media, especially WhatsApp platform, that the issue about local treatment, where you can have local herbs, boil them, then you steam yourself. And do we encourage those things? Are they effective government need to do something and come out clearly so that we can encourage our people to even do those ones. In fact, that can, if it really is the effective, can prevent a lot of people getting acquiring the virus. So, Mr. Speaker, the last issue I want to talk about, which the former Minister of Health and then the nominee for the ministry again, talk about the development of the vaccines and what Honorable Atachi has said. Yes, it's very important that we also, or we challenge our scientists to also come out with a vaccine. In fact, once the vaccines are produced here, we'll even accept it more than the vaccines that will come from other places. Because if we want to rely on vaccines produced from other countries, well, there are a lot of issues being said about them, whether they are true or not. But if we develop the vaccines ourselves here, I think that it will be more acceptable to us than relying on vaccine from other part of the country. So, Mr. Speaker, I think that the debates, the contributions on this statement, if we can forward this into the ministry and the office of the president for action to be taken on them, it will help us as a country. I thank you very much for the opportunity.
Honourable members, having regards to the state of the business of the House, I direct that the House sits outside the regular sitting hours. Yes, Honourable Chief Whip.
Speaker, let me commend the makers of the statement and also say that as a nation, we have shown some leadership in the fight against COVID. But clearly, we have to do more. I couldn't have agreed more with the Deputy Minority Leader when he talks to MPs taking the test. Speaker, I'd like to make this appeal following a few experiences I've gone through, that the Office of the Clerk should make arrangements to ensure that professionals who are supposed to conduct the tests are available as and when it is scheduled. On 2 occasions I've been there and they were nowhere to be found. I had to conduct this test at Kolebu and paid for it myself. And God willing, I was negative. So that has to be taken into consideration. Speaker, a number of issues have been raised relative to the 3 statements presented. I don't intend to prioritize them, but I feel that in my own order of priority, concerns about PR and education is something that we cannot take for granted. And as a country, if we really want to do it, we can't do it. And the PR will have to be fashioned along our way of life. Radio, adverts, and information spread is so critical, especially for our folks in the countryside. And then can we also look at drama on national television, telling the story, revealing the effects of this virus on livelihood. I think if we're able to dramatize this for our people to appreciate, the risks and the scare will become clearer than before. Speaker, it cannot be the case that we are only relying on state institutions. I think our focal persons, like chiefs who are held in high esteem, opinion leaders, chief imams, assembly members who are more often than not closer to the point of action in terms of their proximity to the people. What is our role? What have we been doing so far? And also as members of parliament who are seen and appreciated as opinion leaders, we tend to overly focus on government. And I agree that government has a bigger stake. No doubt about it. I'm not drawing into that debate. But it's a clarion call. Let members of parliament accept our responsibility. Let opinion leaders play the role they have to play, and all will feed into an overarching attempt at ensuring that we overcome this COVID. Speaker, the aspect of Pan-African approach is something that is very dear to me, and also in context multilateralism and bilateralism. The need for a partnership in the development of this vaccine. And we are privileged to be informed by the nominated Minister Designate for Health Ministry that the President has already given some directive in this regard. And it's also refreshing to know that the testing costs at the airports eventually will have to be looked at and reviewed. I think the context in which our honorable member, the Honorable Ablaka, raised the matter is well placed, and it's something that we have to look at. It has to be immediate, and I pray it's done as soon as possible. Speaker, government cannot do everything, and all of us know this. I think it goes without saying that for a long time the President has carried the nation along. All the addresses he's given us, all the interventions that have been given, never in the annals of the history of this country have we witnessed such support in times of pandemic. And I dare say that it's a difficult challenge, it's a difficult time as a nation. We can only urge the President to continue to do what he's doing and maybe do more. But we also don't have to rest on our oars. What we have to do in support of the President, I have to relax, but we have to push more and do it. Speaker, on the vaccination, I think we need to tread with caution. And at the international stage, the World Health Director for WHO, Dr. Tedros, is on record to have complained that wealthy countries, for want of a better word, are stockpiling the vaccines and more or less crowding out on wealthy countries. This is something that is of prime importance. And if there should be equitable distribution of these vaccines, sub-regional bodies will have to rise up and raise the red flag. The African Union, the ECOWAS, other sub-regional bodies will have to speak up. But fact be told, we have to take our destiny in our hands. We will have to prefer our own solutions. I recall when Europe and other countries were taking actions in terms of raising revenue and support. If you look at the target set by the African Union, was something that you cannot write home about. We have to think big as a continent and take the necessary action. Speaker, a few African countries have set the tone. I think Egypt, the Seychelles, and South Africa, especially on administration of the vaccines. What we shouldn't lose sight of is a recommendation given out by the WHO. One of the recommendations given clearly is that all countries should set up a national immunization technical advisory group. I think I'm permitted to say that as a country we have done that, and we have our technical group in place. That is worthy of something we have to be proud of. Then again, the WHO is also recommending that there should be a coordination structure and develop a monitoring system in terms of the delivery of the vaccines. This is something we have to pay attention to, and that we should get our technical men to be on board to give directives how we should deal with this matter. Now, in Egypt, for instance, in Ismaila, priority is given to health, frontline health workers, the aged, and those with chronic immune challenges. This is something we can look at as we prepare to do a distribution of the vaccine and ensure that all these vulnerable people are taken care of. Speaker, more often than not, when we are looking at the vulnerable groups, we tend to women. I think health care workers who are frontline could also be described as vulnerable people. They are the first point of call, they are most exposed, and they have to be categorized as vulnerable people and be dealt with as such. But let me conclude, Speaker, by saying that we also need to celebrate our success story, regardless of all the difficulties, regardless of the fact that the numbers are going up. We have done some positive things as a country. If you look across the continent of Africa, Ghana has set some examples. We've done some things that are very good. What are we doing to improve on the good things that we are doing? And then be able to identify yawning gaps that exists, and then take very good effort to be able to plug them and deal with these challenges. But the focus now should be on solutions. We cannot continue to lament because the virus has come to live with us. And eloquently lamenting as a nation will not resolve the matter. We should focus on solution. It should be all hands on deck. MPs have a role to play, assembly members have a role to play, the clergy, and everybody who matters should heed to the clarion call. I think it is only when we work in unison as a country that we'll be able to overcome this virus. I think on this note, we should continuously encourage our people that the virus can be overcome. We should continuously support government. We should continuously take bonds and continuously spread the good news. The psychological aspect of it is something that we cannot quantify. And let's all join in the fight in dealing with this virus. And I'm sure that this too will pass and Ghana will emerge victorious eventually. Speaker, I thank you for the space granted.
Very well. Regrettably, I did not hear anybody say anything about the contributions of members of this House in the period of the pandemic. I know for a fact that many members of this House did a lot, provided Veronica buckets, provided hand sanitizers, provided nose masks. Indeed, in many communities, we created a pool of nose mask makers. And I think the record should reflect that members of this House have done a lot towards the fight against the spread of coronavirus. On this note, I bring the curtains down on statements. Honorable leaders, any indication? I know it's past 2 o'clock, just in case you have any announcements.
Speaker, we are in your hands. I think item 8 was supposed to have been taken, but I'm reliably informed the report is not ready. So, we are in your hands, Speaker.
Very well. On that note, the House is adjourned to Tuesday. What's Tuesday's date? Let me be sure. The 2nd of February at 2 o'clock at 2 o'clock p.m.